What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. Today, I have a very special guest. She's going to tell us all about the field of neurosurgery, why she went into it, and also some tips for you guys. Dr. Simpson, thank you for coming on with me today. How are you today?
I'm doing good. Anything for a fellow Hoya.
Awesome. Tell the viewers out there who you are and kind of what you do.
Well, I am Dr. Venita Simpson. I am currently a spine deformity and oncology fellow at Baylor and MD Anderson. So I've been in school like my whole entire life in training. And so my fellowship this year is focusing mostly on spine deformity, treating adult degenerative scoliosis and degenerative spine, as well as complex spinal tumors.
Got you. So you're a neurosurgeon by training.
Mm-hmm.
Thinking back to med school, and for those who don't know, actually we went to the same med school at Georgetown, kind of when I first met her. But what was it about neurosurgery? Why did you choose neurosurgery?
You know, I actually wanted to be an orthopedic surgeon initially.
Really?
I went to Georgetown, and you know, Georgetown is huge for ortho. And I was a physical therapist before I went to medical school. So all of my training before medical school was sports medicine related, and I was a dancer. I was taking care of dancers with physical therapy. So naturally, I'm gonna be an orthopedic surgeon. And so I did my research in it. And then on the first day of orthopedics, I was like, oh no, this ain't for me. This is like, this is just not my speed. So it was actually deep brain stimulation is what actually turned my head to neurosurgery. That's not even the part of neurosurgery I'm focusing on. That's called functional neurosurgery. So deep brain stimulation is a part of functional neurosurgery where we place electrodes into the brain to treat movement disorders such as Parkinson's and hemiballismas. So one of our attendings at Georgetown came and showed us a video of a young man with hemiballismas, which is a disorder of the subthalamic nucleus. And so like they have these uncontrolled writhing movements, and he was a young guy, and imagine like living your life moving like this the whole time. And so they showed a video of them doing the deep brain stimulation, and after you place the electrodes in surgery, you don't turn on the battery that's connected into the chest for 2 weeks. And so they show the video of them turning it on for 2 weeks, and then everything just settled down. And then he can move. He didn't move anymore. And like this big smile came across his face. And then he got a job, a girlfriend. I'm like, oh, it's life changing. I'm like, that's me. And then, so I signed up to do a neurosurgery rotation. And then like the first day I knew it was for me because I liked every aspect of it. I mean, of course I loved spine because I was interested in ortho, but I also liked, you know, brain tumors. I liked, you know, pediatrics. There's like so many different parts of neurosurgery that I gravitated to. And it was just like a complete fit for me.
Gotcha. And the neurosurgery residency is probably one of the most challenging ones and also the longest one. How many years is it total to become a neurosurgeon? You had to count med school and residency.
So medical school is 4 years, and then residency is 7 years, and then plus or minus 1 to 2 years of fellowship. So my fellowship is 1 year, spine is 1 year, vascular neurosurgery, which is like clipping aneurysms and treating arteriovenous malformation. That's an additional 2 years. Pediatrics is 1 year. Mostly all of the other fellowships are an additional 1 year. So 8 years usually total.
Gotcha. And that 1 year, is it similar to orthopedics where after residency that 1 year is optional?
For fellowship, yes.
Okay.
Now, because our residency is so long, we're trying to incorporate enfolded fellowships instead of doing a year of complete research. So one of the years of your 7 years is dedicated to research. And depending on the program, you can have, you know, completely dedicated research, meaning that you don't have to take call and you'll be in a lab, and that's good if your program can, you know, handle that, because the call in neurosurgery is ridiculous.
Yeah, that's what I heard.
So Yeah, it's ridiculous. And so, you can't really afford to have people off, during research all the time, 100% committed. But not everyone is interested in research. I'm not a research type of gal. I never have, never will be. You know, kudos to people that want to do that. I will read your research. I do research because I will contribute to the field of neurosurgery, but sitting during bench lab work and pipettes and centrifusion, that's not my thing. I'm more of a clinical oriented type of person. So I prefer to focus on like surgery. And so for those people that are like me who don't want to necessarily have their name published all the time, this is not me. I want to focus more so on the clinical aspect and doing surgery.
All right. So for neurosurgery residency, I know it's 7 years, and then you're a fellow now. Your schedule's a little bit different. What was a typical day for you as a neurosurgery resident? I know it varies by the day in rotation.
Yeah, it varies by the PGY year. In your early PGY years, you're a junior resident, but I trained at a program where they believed in early exposure in the operating room. So our interns, when they were at the VA, they would have, their own room sometimes operating with an attending. So it just depends on the rotation. But in the junior years, it's a lot of holding the pager, a lot of consults, a lot of studying, managing the ICU. We pride ourselves on taking care of our patients, the whole patient.
Yeah.
And so, we have to manage our neuro ICU, and that means putting in central lines, arterial lines, external ventricular drains. External ventricular drains are ventriculostomies, where we're replacing the ventricles of the brain for people that have brain bleeds or hydrocephalus, various reasons. For trauma, putting in intracranial pressure monitors. That's typically like what juniors do and take a ton of call.
Gotcha.
And then the senior years, you basically just operate all day,
Gotcha.
Every day of the week. And our program, we don't have a lot of clinic, maybe depending on the rotation, maybe one day of clinic, which is great because surgeons don't like to go to clinic per se. We like to operate. So, no one complains about that. I mean, in my fellowship now, I do a lot more clinic, which is important because, you have to learn how to see which patients are good candidates for surgery, and you want to see your post-ops, you want to see your work. So for me, like my fellowship experience, the clinic has been like a very rewarding part of it.
Gotcha. And after you do all your training, you do your 7 years of residency and then fellowship, how much can a neurosurgeon make? I know it varies by location. What's about the average kind of going rate?
It depends on if you're doing academics or private practice. It depends on if what part of neurosurgery you specialize in, whether you're doing functional or pediatrics or spine. I'm doing spine, so that's more of the lucrative ones, and I'll be doing private practice when I'm finished with my military commitment. So, I mean, you make a nice amount as a private practice spine surgeon. Like, I don't want to give out a number, but it's well deserved. I can tell you that. It's very well deserved. Now they have regulations on duty hours, but in neurosurgery, that's a gray area because you don't want to leave your job undone, and you don't want to miss out on surgeries because, oh, hey, I may be over a couple of hours. You're going to stay and do your surgeries. You're going to stay and get that experience and learn. I mean, that's a part of being a neurosurgeon. So it's very well deserved.
Gotcha. And for the people who are interested in a busy lifestyle or a busy career like neurosurgery, but they're concerned about the lifestyle and working too much, what are your thoughts?
That is not exactly true. It'll be what you make it. I had a co-resident She was my chief a couple of years ago. She had 2 kids in residency. And yes, it was busy. Yes, it was difficult. But she used to have the nanny come to the parking lot with her babies when she had a free moment. Like you make it work. So it just depends on what type of neurosurgeon you are. Now, if you're a vascular neurosurgeon that treats stroke and have to come in to do strokes in the middle of the night all the time, it's a busy life and a busy call, and that I will say is very demanding. But tumor, not so much. If you chose to specialize in brain tumors, that's mostly elective surgery. Spine is usually elective surgery. There is some aspect of spine trauma, but that usually has to go within 24 hours of an injury. Trauma, cranial neurosurgery, that goes immediately. So that just depends on your call. But it's what you make it. You can be as busy as you want, or you can be as slow as you want. If your goal is to make a lot of money, then you have to be busy to make a lot of money. But if your goal is to just enjoy operating, taking care of patients, but still have a life outside of it and a family life, then you can do that too. And I have a great life.
Yeah, and that's what I always tell students who are kind of discouraged by going into certain fields because of how busy they think they will be. But it's, like you said, it's all about what do you make out of it. So what type of advice would you give to someone who is interested in neurosurgery, especially, minorities, as well as people who may not think they get fit for the field? What type of advice would you give to?
Well, it is exceedingly difficult as a minority, as a Black person, as a woman in the field of neurosurgery. I'm the first African-American female to finish the program at Baylor.
That's awesome.
Ever in history. So it's 2019. That's, how rare, we are in our field. But, I've mentored several girls that have came through and matched, and, not everybody makes it through, but, you can't let anybody tell you no. Always, you won't get yes as the first answer, because I initially didn't match, into neurosurgery when I first applied. And I'm like, how? Why? Like, my board scores are great. I went to a great medical school. I did great rotations. Why? And, just the fact of the matter is, and reality is, like, typically we're not their first choice, no matter how good we look on paper. Like, it's always been a good old boys club for any type of surgery. So not just being a minority, being Black, but being a woman is difficult doing surgery. But, things are changing now. It's becoming, much more common to see women in neurosurgery. My program, at one time, we've had 6 women in our program, which is it's a lot for neurosurgery. 6 out of 21. That's a lot. And my chairman prides himself on creating a diverse culture for neurosurgery, and I applaud him for that. But you just have to find a mentor that can help you and guide you and give you the real all the time. And even when you don't want to hear it, you just have to be prepared to go to plan B if plan A doesn't work. So there are other routes you can get to neurosurgery. If things don't go your way, I've had girls go into like pre-residency fellowships when they hadn't been matched into neurosurgery to better their application. So that's spending a year. And it's not that year doesn't count towards anything, but you get experience. You're basically acting as a neurosurgery intern, and you get experience and you can build your resume. And that's what I recommend to those people that are interested in something as competitive as neurosurgery. If you don't match, do a pre-residency fellowship at a big name place, or you can do a prelim year at a big name place, but it has to be somewhere with a big name that'll boost your CV in somewhere that has a neurosurgery department so that you can get to know them and you can, get them to write you letters of recommendation, because it really is about who you know, where you rotate at and do sub-ides at, because neurosurgery is a very small community and we all talk. Like, I know everybody and everybody knows me. And that's how small this community is. So it matters, being professional and, being a good person and being nice to nurses and, not having a stank attitude. I mean, it's so, and as a woman, sometimes we can be mistaken for being bitchy when we're just being a boss. So, you have to just draw a fine line with that.
Gotcha. That's really good advice. 3 last questions that I ask all of my guests. You can give a 1 to 2 word answer. What is your favorite thing to do outside of medicine?
Well, I travel. I love to travel. I go on a big girl trip every year with my sisters. So I love traveling and going to different countries. And so that's the big answer. But on just a regular day, I brunch.
There you go. What is your favorite food?
Probably it's a tie between seafood and soul food.
Okay.
Oh, no. Food from New Orleans. That is my favorite.
There you go. That's some good food there. And do you have an aspect of neurosurgery that you enjoy the most? I would assume it's deformity surgery and oncology.
Yeah. Spine deformity and spine oncology. I mean, you're doing a spine fellowship. Once you get that good first pedicle subtraction osteotomy and you see that lordosis correction, it's just... to me. I like spine because it's actually immediate gratification, because I can see what I did to help the patient. And most of the time, they wake up like, oh my God, thank you, my arm pain is gone. Thank you, my leg pain is gone. Like, now I can finally go back to work. So like, that's the aspect of neurosurgery that I like, because I, for the most part, always help them.
Well, Dr. Simpson, thank you so much for coming on today. You're a huge inspiration. I don't honestly know any Black neurosurgeon women, so you're the only person that I know. So that's the reason why I kind of do this channel, is to show other people, a young lady who may be going through the years and may not even know it's possible to become a neurosurgeon, that she sees this video of you and wants to become one. So that's why I applaud you, salute you, and congrats on all your success.
Thank you. And you can leave my contact, because most girls or guys can reach out to me too. Guys reach out to me too, but a lot of people just, hit me up on social media and ask questions about neurosurgery or surgery. And I know a lot of women in all fields of medicine and surgery, and I love connecting young ladies with mentors. So you can list my contact information if they want to reach out to me, if they have questions about any aspect of surgery or medicine. Like, I know women in every single specialty, so I am more than happy to connect the dots.
Gotcha. What's the best way for them to contact you?
They can email me. I actually still use my Georgetown account. bms24@georgetown.edu, or they can hit me up on Instagram. My Instagram is Dr. V Marie. It's Dr._VEEMARIE.
Okay, and I'll put links to all those in the description. Dr. Simpson, thank you so much. And
no problem.
Thanks for coming on today.